Thyroid health is often overlooked, yet it influences so many aspects of our well-being. This small, butterfly-shaped gland located at the base of our necks plays a crucial role in various bodily functions, from controlling our metabolism to regulating our heart rate. However, its importance is frequently underestimated until it starts malfunctioning. Thyroid disorders are surprisingly common, affecting millions worldwide. They can range from small, harmless goiters that don't need treatment to life-threatening cancer. Unfortunately, thyroid cancer is on the rise, making it more essential than ever to understand its warning signs. But how do we recognize these signs when they appear? How do we know if our thyroid is in trouble? The answer lies in being informed and proactive about our health. Do you know the warning signs of thyroid cancer? Stick around as we delve into the 10 warning signs that you must not ignore. The first and most common sign of thyroid cancer is a lump in your neck. This lump is typically felt as a hard, immovable mass that may cause some discomfort but not necessarily pain. It's often located towards the front of your neck, in the vicinity of your Adam's apple. Now you might be wondering, why does this lump occur? Well, when cells in your thyroid begin to change and grow uncontrollably, they can form a tumor. If this tumor is non-cancerous, it's called a benign thyroid nodule. But if it's cancerous, we refer to it as a malignant thyroid tumor or simply thyroid cancer. Here's a quick tip. Stand in front of a mirror, tilt your head back, take a sip of water, and swallow. If you notice any protrusions or bulges when you do this, it could be a sign of a thyroid lump. Keep in mind, not all neck lumps are cancerous, but it's crucial to get any lump checked out by a healthcare professional. Early detection can make all the difference, so don't hesitate in seeking help. Another warning sign of thyroid cancer is difficulty swallowing. Now you might be wondering, why would thyroid cancer cause this? Well, the thyroid gland is located in the neck, and when a tumor forms, it can press on the esophagus. That's the tube that helps transport food from your mouth to your stomach. This pressure can make swallowing feel uncomfortable or even painful. It's not just about feeling a lump in your throat, but it could be a struggle to swallow food or drink, or maybe you've started choking or coughing when you eat. This isn't something to brush off as a minor annoyance. It could be a sign that your thyroid is not quite right. So if you notice any changes in swallowing, it's crucial to seek medical advice. Changes in your voice and a persistent cough could also indicate thyroid cancer. Your voice is a marvel, as it's produced by your vocal cords in the larynx, or voice box, which sits just above your thyroid gland. If a tumor starts to press on your larynx, it could cause your voice to change, become hoarse, or even lead to voice loss. On the other hand, a persistent cough that isn't related to a cold or allergies could be another sign. This could be caused by a tumor pressing on the windpipe or trachea, leading to irritation and a chronic cough. So, what changes should you look out for? If your voice has become hoarse or raspy, if you're experiencing voice fatigue, or if you've developed a persistent cough that just won't quit, it might be time to see a doctor. Remember, these symptoms can also be related to other conditions, but it's always better to be safe and get checked out. Neck pain and swollen lymph nodes are other signs not to ignore. Now, you might be wondering why these symptoms are connected to thyroid health. Well, the thyroid gland is located in the neck, and when it's not working properly, it can cause discomfort in that area. Swollen lymph nodes, on the other hand, are often a response to infection or illness. But when these nodes remain swollen for an extended period, it may suggest a more significant issue, like thyroid cancer. Identifying these signs involves being in tune with your body. Is the pain in your neck persistent even after rest and treatment? Are the lymph nodes in your neck noticeably larger or tender to touch? If you're nodding along to these questions, it's essential to seek medical advice. Looking out for these symptoms and acting promptly can make a world of difference. Remember, don't write off neck pain or swollen lymph nodes as just a common cold or strain. It could be something more serious. Unexplained fatigue and weight changes are other signs to watch out for. Your thyroid, a butterfly-shaped gland located in your neck, plays a significant role in your metabolism, energy levels, and body weight. When the thyroid is under attack, as in the case of thyroid cancer, it can cause fatigue and fluctuations in weight. This is because the thyroid gland produces hormones that regulate your body's energy use. If the gland is not working properly due to cancer, it may produce too much or too little of these hormones, leading to sudden weight gain or loss. and feelings of tiredness or weakness. Remember, everyone feels tired and experiences weight changes from time to time. But if you're constantly feeling drained, even after a good night's sleep, or if you're gaining or losing weight without any changes to your diet or exercise routine, these could be signs that something is not right. It's important to listen to your body. If you're feeling unusually tired or notice sudden weight changes, seek medical advice. The final warning signs are shortness of breath and a rapid heart rate. Now, why do these signs occur? The thyroid gland produces hormones that control many activities in your body, including how fast your heart beats and how deep or rapid your breaths are. When your thyroid is overactive, a condition known as hyperthyroidism, it can cause your heart to beat faster, often leading to palpitations. Similarly, this overactivity can lead to shortness of breath, especially during physical exertion. So what changes should you look out for? If you find yourself gasping for air after climbing just a flight of stairs, or if your heart seems to be beating out of rhythm even when you're at rest, these could be telltale signs that something isn't quite right. It's essential to understand that these symptoms could be linked to other health conditions too, not just thyroid disorders. Therefore, it's crucial to consult a healthcare professional for a comprehensive evaluation. Any changes in your breathing or heart rate should not be ignored. To recap, the 10 warning signs of thyroid cancer are a lump in your neck, difficulty swallowing, changes in voice, a persistent cough, neck pain, swollen lymph nodes, fatigue, weight changes, shortness of breath, and a rapid heart rate. Each of these signs could be an indication that your thyroid is not functioning as it should be. Now, why is it important to be aware of these signs? Well, it's all about early detection. The earlier a condition is detected, the more effectively it can be treated. This is particularly true for thyroid cancer. If it's caught early, the 5-year survival rate is almost 100%. That's a number that should give us all hope. But it's not just about survival. Detecting thyroid cancer early also means that treatment can be less invasive and have fewer side effects. It can mean the difference between a minor surgical procedure and a major one. It can mean preserving your voice, swallowing ability, and overall quality of life. So what should you do if you notice any of these warning signs? The first step is to seek medical advice. Don't panic, but don't ignore the signs either. A healthcare professional can provide a proper diagnosis and guide you through the next steps. Remember, your health is in your hands. Don't ignore these warning signs. If you have any of these symptoms, please see a healthcare professional immediately.